So, Andrew, I want to ask on behalf of some of the caregivers that we have out there that are watching and listening, with regard to difficulties surrounding medication, like if you're having trouble getting your loved one to take it, or what kind of things should you be looking for, or bad reactions and that kind of stuff. If you could kind of lend your advice toward that.
Yeah. So when it comes to medications, the way I first think about it are, what are the medications that could actually interfere with people's thinking and memory? And there are lists of these. They're often compiled for doctors every year, called the Beers list, Beers, and you can Google it and you can find it online. We also have it in several of the books I've written. Almost all the recent versions have copies of lists of medications that can actually make individuals' thinking and memory worse. And if you check these lists and you find that your loved one is on one of these medications, it doesn't mean you should stop it, but it does mean you should speak with your doctor about whether they have to be on this medication. Could the dose be lowered? Could it be substituted for a different medication that does the same thing, that isn't on the list of medicines that can cause trouble with thinking and memory? So that's the first thing I always think about. Then when it comes to medications that can actually be helpful, there's a few different classes of medicines. Even if the problem is trouble with behavior, that somebody is, having behavioral problems, they're agitated, they're angry, they're aggressive, something like that. The first thing I always try to do is to boost up their thinking and memory. Because after all, before they developed dementia, they didn't have these problems, right? So if you can do something that can turn the clock back on their dementia and make them the way they were 6 to 12 months ago, maybe that will help. And those are medications that increase the level of acetylcholine in the brain. These are medications that include donepezil, brand named Aricept, rivastigmine, brand name Exelon, and galantamine. So all of those medications help to boost up levels of acetylcholine and can turn the clock back on the dementia by 6 to 12 months. After that, the next thing I try are medications that just help people feel a little bit more calm. And these are generally medications in the Prozac family of medicines, but a few specific ones that work well in the older adult who has dementia. And my two favorites are sertraline, whose brand name is Zoloft, and escitalopram, whose brand name is Lexapro. And then finally, there are a class of medications that help to suppress problem behaviors. And these are medications that should be used with caution. They can cause serious side effects and risks, including stroke and death. And these are medications that are so-called atypical neuroleptic medications. And they include things like risperidone, brand name is Risperdal, quetiapine, brand name Seroquel, and olanzapine, brand named Zyprexa. So all of those medications help to suppress behaviors. Now, if the individual doesn't want to take the medications, assuming that they are past the stage of dementia where they have the capacity to reasonably judge whether the medication is good for them or not good for them, assuming we're past that stage and, we know the medication is good for them. If they were thinking clearly, they would take it, but, they're fighting you because the dementia's taken over. In those situations, sometimes the easiest thing to do is to crush the medication if the pharmacist says it's allowed, and you put it in applesauce or something like that. There are some medications that are liquid. Sometimes that's much easier to do, and again, it can be put in applesauce or ice cream or something like that. And when it comes to problem solving for things like this, I'm a big believer in just using common sense approach to try to problem solve. So those are some suggestions about medications.
Hey folks, connecting with your benefits is our primary mission, and the SITREP is providing more options than ever.
Subscribe to our free email newsletter, subscribe to our audio podcast channel, or subscribe to our content on YouTube.
For details and links, check out the description below.